better. And as these cases increase and we learn more about the virus itself, we have a lot of questions and, of course, concerns. It's a really unsettling time. So we're committed to bringing you the facts without fear. And to help us do that, let's bring in Dr. Lisa Larkin, an internal medicine and women's health specialist. Dr. Larkin, thank you so much for taking the time. We have so many questions, so we're going to try and do a little rapid fire. I know that there's no definitive date of when this will end, but we have heard it's going to get worse before it gets better, as I mentioned. So based on the data from other countries and new data from the U.S., what do we know about this virus, and how long should we be preparing to live as we are now with social distancing and trying to isolate as much as possible if we separate that from what the president just said in his news conference?
Right. I think that's really what's so confusing is you're hearing mixed messages from the president and really what we know is going on in other countries. I think if you look at what went on in China, we all know that this is going to be longer than just a few weeks here. And I think the timing may be really 4 months. I mean, we're really looking at probably a July, August timeframe, which obviously is much longer than what the president is talking about.
Dr. Larkin, this is James Packard. So you're talking about working from home, being away from people up until July, August.
Well, again, I mean, we don't really know exactly how this is going to evolve, but clearly, as you've said on the program today, the numbers are rapidly increasing. We certainly have not started to flatten the curve yet and spread this out. And so the social distancing is absolutely critical right now. And again, how long exactly that's going to take is anybody's guess. But again, looking at what's going on in Italy, looking at what's going on in China, I think the expectation, unfortunately, is much longer than just 1, 2, 3 weeks from now.
So not to make you a political pundit here, removing from the politics of this, because you're a healthcare professional, from that standpoint, is it possible right now or in the next 2 or 3 weeks to both start opening sectors of the economy and returning people to work and fight the virus at the same time?
Well, again, my opinion is really that it is not possible to do those things at the same time, that really the social distancing is absolutely so critical and that we have not started to flatten the curve yet. I think really when you think about the social distancing, what you're trying to do is the longer you can do it, obviously, an individual who is infected decreases the number of people that they will infect by social distancing. And the impact is dramatic. Without the social distancing, the increase continues to escalate exponentially, and we have to continue doing the social distancing longer than we want. Now, can you open parts of the economy? I mean, again, I'm to take it out of politics. I don't have the right answer for that, but from the healthcare standpoint, we have not started to flatten this curve yet, and it's going to take longer than we want.
And following up on social distancing, the CDC is telling doctors not all people with symptoms need to be tested. They need to prioritize. We saw Senator Rand Paul, who said he had no symptoms, and he tested positive. So if we can't identify people who are positive, can we effectively stop the spread, even if those people are heeding calls to stay in and less going to the store or the doctor? Because I guess, in my view, even if they're staying in, but they're going to get those essentials, they could still spread it.
Right. So I think the thing you have to understand is that social distancing is not perfect. But look at the impact that you can have with it. If we take one individual who's just living their lives normally, we believe that in 30 days, 400 plus patients will be infected. If we can cut social distancing in half, so your exposure is to half as many people over the same time frame, only about 15 people will be infected. And if you cut that down to 75%, so you're really isolating yourself much more, you can get it down to 2 people. And so the impact of social distancing is not zero. Okay, so yes, people are shedding virus even without symptoms and can be infecting other people without symptoms. That's why the social distancing is so important, because you want to make the numbers much less. It's not perfect, but we have got to flatten the curve. The whole risk is overwhelming our healthcare system, and the numbers are terrifying if we don't flatten the curve.
Dr. Larkin, when you hear people talk about previous pandemics, even previous outbreaks of the flu, for instance, the swine flu in 2009, I mean, when those things happened, we didn't devote hours and hours and back-to-back coverage of those outbreaks. It was a big story, yes, but not like this. We didn't see an economic impact like this. And so when people start making those comparisons of, look how many people the swine flu killed versus look how many people the coronavirus has killed so far, what's your response to that? Is it just that we're dealing with an unknown for which we don't really have a vaccine or a one-track treatment? We don't know what this is?
Right. So it's really a great question. And I think there is really a big difference. So the swine flu is an influenza type virus, H1N1. And so what we know in populations is influenza has been around a long time. And in our population, we have some degree of herd immunity. In addition, swine flu, H1N1, the mortality from that is lower than with COVID-19. So what's COVID-19? So coronavirus. So this is a new virus that we have not been exposed to. And so the population as a whole does not have any herd immunity. And so the rate at which this can spread through the population is much larger, which is why you're seeing this exponential growth. Now, again, people who are infected will then have antibodies, and we will start, as more and more of the population is infected, to have some herd immunity. But right now we don't. And so this is actually very different than the swine flu. And the mortality of this is higher than the swine flu, but this is a novel virus. And so this is a different outbreak. And I think you can see from what's going on in Italy and China. I mean, you know, you look globally, this is a huge deal. We do not have this under control.
It is certainly an unsettling time, so many unknowns. And this kind of gets to it. I heard New York Governor Andrew Cuomo say today that the silver lining in all of this is that we can spend more time with our families. I've been doing that via FaceTime because my question to you, and maybe you can answer this for me and my family and many of the families out there, should we even be spending time with our family members? My parents are in their late 50s, so they're not considered in that higher risk group yet. But I'm concerned to go to their house and visit them because I am younger, and for all I know, I could already be infected.
Right. So I'm the same age as your parents. And I have this discussion with my son as well, who's an adult living in a different city and who's now working remotely about whether or not he can come home or should come home. I mean, here's the reality. It's just what I said about the social distancing, which is that the smaller you can make your network, the smaller number of people that you can have contact with, the better that is in terms of the exponential growth that we can potentially see from this virus. So the answer is, it's not black or white. Again, if you want to visit your family, that's another exposure. You've probably been around many more people than your parents have been around. And so again, you're bringing your exposure into their world. The bottom line is less is more. I'd love to have my son come home and work remotely from here. His exposure is higher. Would I absolutely say no? No, I'm healthy, but again, the whole concept is really less is more right now, and I can't emphasize that enough.
Larkin, we can tell by the string of text messages that you are in high demand tonight, and we really appreciate you carving out some time for us. That's all right. What's important is the context and your insight. So we really appreciate you spending some time with us tonight. Thank you.